Warning: watch this video or you will regret it. Stroke, a familiar name, but always makes people startled and scared. It comes suddenly, without knocking on the door, without warning. 1 minute you are still healthy, the next minute you are unconscious, paralyzed on one side, or never wake up again. For the elderly, stroke is a silent killer, taking away lives or leaving severe consequences that cannot be dealt with. But what is even more frightening is that many people do not know that they are carrying a time bomb in their body until it is too late. Therefore, understanding correctly, to identify, prevent, and act promptly, is the best way to avoid losing a loved one in the blink of an eye. What is a stroke? When the blood flow is interrupted, a stroke, also known as a cerebrovascular accident, occurs when the blood flow carrying oxygen and nutrients to the brain is interrupted. There are two main types: ischemic stroke, accounting for about 85% caused by a blood clot blocking a blood vessel, and hemorrhagic stroke, caused by a ruptured blood vessel causing blood to spill into brain tissue. When blood is not reaching the brain for several minutes, brain cells begin to die. The brain is an organ that cannot wait. Every second that passes without oxygen, millions of nerve cells are lost forever. Therefore, a stroke is an absolute emergency. Every minute that passes without intervention increases the risk of death or disability significantly. In the elderly, the risk of stroke is greater due to aging blood vessels, which are prone to atherosclerosis and rupture, and are accompanied by many underlying diseases such as high blood pressure, diabetes, and cardiovascular disease. The danger is that strokes often have no obvious signs until they occur, and then every minute is a race to save life. Warning signs: the body is talking. Strokes do not always happen in a flash, as depicted in the movies. In fact, the body often warns in advance with small but important signs. If recognized in time, it can save lives. Remember the FAST principle, the formula for early stroke recognition. F, face. Distorted face, uneven smile, one side of the mouth droops. A, arms. Weakness or paralysis of one arm or leg, unable to raise evenly. S, speech. Slurred speech, difficulty speaking, unable to understand speech. T, time. Time is gold. If you have the above signs, you need to go to the hospital immediately. In addition, there are other symptoms such as sudden loss of balance, dizziness, blurred vision in one eye, severe headache with no known cause, even fainting. Some people also have transient ischemic attacks, TIA, stroke-like symptoms but only last a few minutes and then go away on their own. Don't be subjective. TIA is a yellow light signaling that a real stroke may occur in the next few days. Early recognition, early action is the key to survival. What are the risks that lead to a stroke? No one has a stroke without a reason. There are always hidden risks behind it, especially in the elderly. Here are the leading factors that lead to stroke. High blood pressure is the #1 culprit, causing damage to the brain's blood vessels and creating conditions for both blockage and rupture. Diabetes increases the risk of atherosclerosis, reduces blood circulation, and can easily cause ischemic stroke. Cardiovascular disease, atrial fibrillation, heart failure, myocardial infarction are all directly related to the risk of blood clots leading to stroke. High blood fat, cholesterol, easily causes atherosclerosis, plaque formation in the arteries, blocking blood flow to the brain. Smoking, alcohol, damages blood vessels, increases blood pressure, increases the risk of blood clots. Lack of exercise, being overweight. These are the foundations for many chronic diseases, all of which are stepping stones for stroke. The older you are, the greater the risk. But if you know these factors and control them well, you can prevent a stroke before it happens. Stroke happens. What to do immediately? When a stroke occurs, time is everything. You only have 4.5 golden hours to take the patient to the hospital and use thrombolytic drugs. If this time passes, the chance of saving the patient will be severely reduced. Absolutely do not. Let the patient rest at home because you think it is just tired. Give them water, porridge, or give them medicine on your own. Scrape the patient's back, acupressure, or take them to a place without emergency equipment. Do the following immediately. Call 115 as soon as possible. Remember when the symptoms first appeared. It is very important for the doctor to decide on the treatment method. Place the patient on his side, head slightly raised, keep the airway clear. Avoid shaking or moving them vigorously. Encourage the patient and help them stay calm. At the hospital, the doctor will determine the type of stroke, occlusive or hemorrhagic, by CT or MRI, and then choose the appropriate treatment regimen. Millions of brain cells are lost every minute. Don't delay. Stroke prevention, starting today. The good news is, 80% of strokes can be prevented if you change your lifestyle and control underlying diseases well. Control blood pressure. This is the most important thing. Measure blood pressure regularly. Keep it stable below 140 over 90 millimeters of mercury, or as prescribed by your doctor. Control blood sugar and blood lipids. Regular checkups. Take medication regularly if you have a disease. Quit smoking. Limit alcohol. The sooner the better. Exercise regularly, 30 minutes a day, 5 days a week. Choose gentle activities such as walking, cycling, yoga. Eat healthy. Eat lots of green vegetables, fish, fruits. Limit salt, sugar, fried foods. Maintain a reasonable weight. BMI under 25 is a safe goal. Regular health checkups. Don't wait until you're sick to go to the doctor. Early detection is the chance of survival, and especially if you've had a TIA, consider it a final warning, and act before a real stroke comes knocking. Stroke does not choose people. It can knock on anyone's door at any time, especially in old age, when health is more fragile than ever. But stroke is not destiny. Just understand clearly, identify correctly, act promptly, and take proactive precautions. You have won more than half the battle. Don't let moments of negligence turn into regret. Protect yourself and your loved ones, starting today, before the unannounced killer has time to strike. If you want an English version with Vietnamese captions, or add a preface to each part to make the video more engaging, I can add it right away.